Welcome to Tech Empire. I'm Michael Quet, joined by Siamo Malachi, and today we welcome Fatima Hassan to discuss vaccine apartheid in the global movement to end it. Fatima is a South African human rights lawyer, social activist, and founder of the Health Justice Initiative. Fatima, welcome to the show.
Thank you so much for having me on. It's great.
So in this episode, we're going to dig into the issue of vaccine apartheid, including topics like vaccine patents, the People's Vaccine Alliance, the Omicron travel bans, and the role of the Bill and Melinda Gates Foundation. Before we continue, none of the people on this show take money from Bill and Melinda Gates.
Or will ever take money from Bill and Melinda Gates.
Right. So I just want to throw that out there because they're everywhere, right? A quick note, Tech Empire is part of the Yale Podcast Network. You can find us on SoundCloud, iTunes, and YouTube. Our Twitter account is @TechEmpireCast. So Fatima, let's start with a basic question. What is vaccine apartheid?
So vaccine apartheid is a system where you have a prioritization of limited vaccine supplies for people and countries in the global north. And you create a system whereby people in the global south have to wait and wait and wait. So what we've seen in the last 15 months is basically, the clearest illustration of vaccine apartheid, where vaccine supplies were prioritized for people who were able to order in advance, or what we call enter into advanced market commitments. And they were able to basically clear the shelves and use all of those supplies for their population or their countries first, to the exclusion of healthcare workers and people at risk in the global south. So the situation of vaccine apartheid has resulted in only about 7% of people being fully vaccinated in Africa, as at the beginning of December 2021, whereas in other parts of the world, you're looking at coverage of maybe ranging between 40 to 80%, while those countries are now administering booster shots, even though people in Africa haven't even had their first shot.
Yeah, it's crazy. I mean, over 8 billion doses already administered around the world. I suppose the follow-up question to that is, these countries that are giving out boosters, that are administering vaccine apartheid, sometimes their leaders release statements saying things like, okay, we're going to donate to Africa. There were multiple initiatives that were created with global bodies to try and give vaccines. Why did all of those fail? And why did the words of the global leaders, why did they go back on their word?
So, I think that's a great question, because in the beginning of the pandemic, we warned, based on the lessons we learned in the HIV/AIDS crisis, that offers of solidarity and donation and offers of donation and solidarity and pledges are not enforceable. Unless you have enforceable guarantees, then nice statements and PR statements and ribbon-cutting ceremonies are not actually going to result in deliveries into the places where they need it the most. So what we have is a situation where, of the 8 billion doses of vaccines already administered in the world, the majority of that has actually gone to high-income countries. And there's data and reports that indicate that, with a very small percentage actually going to low-income countries. And that, I think, is a travesty. It's an illustration of vaccine apartheid and vaccine injustice. So when you talk about the donations and pledges, so let me just say that again. When you talk about the donations and pledges, we're looking at two different streams here. The first is your ordinary donations and pledges, which mostly have been conveyed by G7 countries, but have actually not fully materialized. Our data and the work of the People's Vaccine Alliance globally indicates that only about 20% of those promises have actually been met by the end of this year. So there's a lot of global leaders who are trying to take credit for promises that they've made, but actually they haven't really honored those promises. So there's a huge shortage of the supplies that were promised through a donation stream by these richer nations. The second way in which these pledges or donations or promises were supposed to materialize, and that you've correctly sort of identified as having failed, is the mechanism called COVAX, which was supposed to be a mechanism that would also allow low-income countries to be able to draw on a pooled mechanism of supplies. And COVAX has had to reduce its forecast of even very low targets for 2021 by a further 500 million, because the companies and the countries that had made promises to put supplies into the COVAX machinery have actually not met those promises or pledges. So COVAX is unable to deliver on time the number of supplies that you need. The countries that have made promises through G7 or G20 have not met those promises or their pledges either. And bilateral agreements that countries entered into, if they have the resources to do that in Africa in particular, are still waiting for supplies that they've actually paid for. Why has the world failed? Because frankly, I think that actually nobody really cares about Black and brown people in parts of Africa and Latin America and Asia. That's the only reason why there is a 7% vaccination rate in Africa. If the world was really concerned about all of us being in this pandemic together and that we were really all going to offer each other global solidarity, we would be seeing a very different situation. Just today, we've had global leaders saying that our president in South Africa, who's called out vaccine apartheid as being dramatic. We've had the CEO of a pharmaceutical company saying that the DG of the WHO is being too emotional when he talks about vaccine apartheid. So this is the systemic structural realities we're dealing with. Nobody wants to accept responsibility. Everybody wants the credit and everybody wants the profit.
Now, there's if we were to back up for a second, right? This broke out in China, as far as we know, December 2019, and it quickly became a global pandemic. And at that point, there was obviously the question, well, what are we going to do? There was the question of developing a vaccine. And in the process of doing that at the outset, there was a recommendation for pooling technology and the scientific results behind a vaccine. You had just mentioned COVAX. But there was another proposal, if I'm from memory here, it was called CTAP, and what won out was COVAX. In particular, Bill Gates and the Bill and Melinda Gates Foundation were pushing very hard for protecting intellectual property behind the vaccines. So can you tell us a little bit about what happened at that moment in time, and what your thoughts are on this controversy behind waiving intellectual property patents behind the vaccines?
Okay, so I think there's three parts to that question. Let's deal with the IP part and the proposal to waive intellectual property provisions during this pandemic, which was actually a proposal that was jointly made by the governments of India and South Africa already in October of 2020. So given what we'd learned with the HIV/AIDS crisis and how if you don't deal with the stranglehold of intellectual property, particularly patents, I mean, there are other elements to intellectual property, including copyright and trade secrets, etc. But if you don't deal with that basket of intellectual property protections all at once for all medical technologies that could actually save lives in this pandemic, then you would have the result that we have right now, which is, gross inequity and gross disparities in access to supplies. Because if you, for example, have to vaccinate billions of people around the world at the same time, not with one shot, but maybe two shots, but maybe three shots, you need to have as many manufacturers as possible in the system to be able to help you to make those vaccines. And you can't do that if the knowledge is not shared. And the knowledge usually resides in a patent or in a copyright or in some intellectual property claim, even though in this particular case, in this pandemic, we had accelerated vaccine research, which was funded by public money. And so this is the irony of this pandemic, when we were offered solidarity and we were told that the vaccine in particular would be treated as a public good, that you socialize the risk of researching the vaccines, but then you privatize access. So how did we get to the point of privatizing access? Well, a few things. The one is this, inexplicable fixation with prioritizing intellectual property rights over human life. And that is why we have the situation that we have right now of vaccine inequity. And we are going to see that with treatment, and we're already seeing that with access to PPE, access to diagnostic test kits, access to ventilators, for example. So the idea was that you would put public investment on the table and that everybody would share the knowledge. But the opposite happened, because pharmaceutical companies are not interested necessarily in actually saving lives. They're interested in saving some lives. And I think that's the heart of where we're at. And so in saving some lives and not all lives, they are interested in making sure that they have control over the means of production, that they have exclusive control, it's what we call exclusivity, of markets, of data, of pricing, etc. And they get to make all the decisions. So I've said before on multiple occasions, we have 4 or 5 white men in the North who are the CEOs of these pharmaceutical companies who are playing God in this pandemic. So they got to have the ability to make key material decisions, which has affected the entire world. So how has this happened? When you talk about CTAP, the idea behind CTAP was, well, we'll invest in all of this research. We're all in this together in this particular pandemic. We all want to get out of the pandemic at the same time. So why don't we set up a mechanism that pools the technology? People will come towards CTAP, they will provide the technology, and everybody will benefit and share for that. For 18 months or close to 2 years, we didn't have a single company voluntarily agreeing to come into CTAP. We've just recently had an announcement by the Spanish government to finally give some technology on diagnostic capability. So that is the only technology transfer that we have within the CTAP mechanism. In addition to CTAP, you have COVAX being set up by similar partners, including by very wealthy individuals, philanthropists, who also put some money into vaccine research, which explains why they get to be kingmakers in this particular pandemic. Unlike, for example, somebody like Dolly Parton. Dolly Parton Foundation puts money into vaccine research, but has not insisted on making decisions around licensing or exclusivity. So COVAX is a very different mechanism. COVAX is like a pool procurement mechanism, a tiered pricing system for 3 different types of countries: high income, middle income, low income. And the idea was that you would pool procurement, and then of available supplies, you would allocate them equitably to the different parts of the world, and you would donate the supplies to low-income countries if they couldn't afford it. The problem that happened is that richer countries then signed their advanced purchase orders or advanced market commitments and drew on supplies from COVAX, because COVAX doesn't require you to share your technology. It's totally based on voluntary cooperation. We have companies who have made promises to COVAX who haven't even delivered a single dose that they said that they would to COVAX. So there's no repercussion for you if you don't honor your commitments to COVAX. And similarly, CTAP is based on a voluntary cooperation system. The third measure that was then subsequently introduced was when we had a lot of pushback around sharing the technology with partners in the global south. The first thing we heard, which is what we heard in HIV/AIDS, were these very racist views that Africa can't produce anything. It won't be of high quality, that it's not so easy to make a vaccine. You can't just easily do a copy of an mRNA vaccine in Africa or Latin America and Asia. So the WHO, in fact, embarked on a process where they invited expressions of interest. And that is how we got to the process of setting up the first WHO mRNA hub in South Africa. But guess what? For 2 years, not a single company has voluntarily come with the knowledge or the technology into the hub So we are going to have to reverse engineer some of those interventions and take longer to be able to also scale up production of vaccines. So when we talk about, what happened and how did this all go so belly up, it's because we relied on a system and a market that has never served our needs before. It's never served the needs of poor people in low-income parts of the world. And we assumed that people would be benevolent. We assumed that there would be voluntary cooperation. We assumed that with public investment, all of the money that the US government put on the table, all of the money that the UK government, the German government, that you wouldn't have drug companies contesting whose IP it is. What do we have right now? A dispute between Moderna and the US government around who actually owns the Moderna NIH vaccine. We call it the NIH vaccine. Moderna calls it the Moderna vaccine. But they are the ones who have made billions in profit, in the last year. So that is where we act in terms of the contestation of IP and why the waiver was so important. Just the final point on the waiver is that 110 countries, mostly from the developing world, support the waiver. It has now at least 67 co-sponsors, but guess what? It's blocked by the very countries that are giving booster shots. It's blocked by the very countries that are now banning us from travel and blaming us for the emergence of new variants. And it's blocked by the countries who are really not genuinely concerned about trying to get timely supplies of vaccines to Africa.
Yeah, thanks for all that clarity. I think the core of that, if you rely on voluntary contributions from people that have power to the powerless, you're doomed to fail. And one wonders if we had a bit more bargaining power at the time when South Africa, for instance, was volunteering to participate in trials. But I'd also like to hear your thoughts on this new agreement between Aspen and J&J. Is it something to look forward to? Is it a Trojan horse? Is it a myth? Is it being overstated? You're speaking about reverse engineering as well, a vaccine. Do you think that's something we could do? Could we work towards that? We've seen lessons from Cuba. Is that something optimistic and something you think we should be putting more energy into instead of the waiver and begging for permission from these large pharmaceuticals?
Yeah, so the waiver is a critical element of our response to this pandemic. And, we certainly don't see it as a begging bowl. It's perfectly permissible within the rules of the TRIPS agreement. And we can debate around whether TRIPS is actually serving our purpose during the time of a pandemic. We don't think it is, and we think it's time for reform at the WTO, and we need greater systemic reform. But the waiver is a permissible mechanism under the rules of the TRIPS agreement. So it's not begging. It's asking to be able to use the very rules that are available, which other countries have used when they face some kind of emergency, but are precluding the global south from using in the time of a public health emergency. And these are some of the concessions that we won in the HIV/AIDS battle through what's called the Doha Declaration, and about the ability of countries to use flexibilities so that you can respond to a public health emergency. So let's look at the J&J situation. When you ask the question about, why has everything failed and why haven't we had widespread access? It's precisely because of the conduct of companies like Johnson & Johnson. So Johnson & Johnson decides that they will be able to serve the world with their vaccine, that it's a vaccine that everybody should use. They do clinical trials in South Africa. They test it first on healthcare workers, for example. There's been some issues around starting, the rollout, pausing the rollout. But the bottom line is that Johnson & Johnson decides that they're not going to share the technology with anybody. They're going to hoard this knowledge during this pandemic. And in doing so, they have obviously made billions and billions in profit. But what they will do is rely on a handful of companies around the world to fill and finish the vaccine for them. So when you fill and finish, you don't actually have the full technology transfer. And that's what we mean by partial licensing. So it's a very convenient way for Johnson & Johnson to say, but we've given you a deal in South Africa. But when you look at the terms of it, and remember, nobody's seen the contracts because these are all subject to high levels of secrecy and non-disclosure agreements, which doesn't really bode well for a functioning democracy anywhere in the world. So what Johnson & Johnson does is it says to Aspen, we'll select you as a partner. Nobody else in Africa, not many other countries in the global south. Johnson & Johnson decides on their own that they will choose Aspen. Aspen will fill and finish. They decide the volumes, they decide the prices, and they importantly decide the market. So when we say we're not doing cartwheels about that license arrangement, this is the reason why. In deciding the markets, Johnson & Johnson then has the power and authority to decide the vaccines that are filled and finished in South Africa will first go to where. So we are entering wave 3, we are waiting for supplies. The global north is getting vaccinated. I'm talking of mid-2021. And Johnson & Johnson is unable to deliver vaccine supplies to us on a speedy basis, in a timely basis, according to the contract that we've signed with them. We've paid them for vaccines because of two reasons. The contamination issue that it's dealing with in Baltimore, because it's not allowing Aspen to produce the drug substance. It's not a full manufacturing license. But what is—
And can I just ask, just real quick, can you just fill the audience in on this relationship? Yeah.
Yeah, so Aspen is a pharmaceutical company in South Africa that has previously, been able to manufacture HIV, TB, malaria medicines as well. And it supplies countries in Europe, countries in sub-Saharan Africa. So it's a well-established pharmaceutical company. But it's handpicked by Johnson & Johnson. And so Aspen is filling and finishing vaccines in the Eastern Cape during this time. And we are not getting our supplies in Africa or in South Africa, despite signing the contract. So we're not even begging for donations. We've paid, and we want our contract to be honored. They take the fill and finish vaccines and they export them to Europe. And that is what we mean by having exclusive control over the terms of the arrangement, where they have the power to decide, even though your country is going through a wave 3, even though you're facing a new variant, even though you really need, access to urgent supplies. The New York Times broke a story which showed that for months, millions of vaccines had actually left South Africa to go to Europe. So the latest announcement, Yamo, around the Aspen J&J deal is that for more than a year, they are negotiating about when Aspen will actually get a full manufacturing license, which would give Aspen more control and authority around where the supplies would go to, how to actually deal with allocation and distribution, and a range of other things. But the most recent announcement indicates that that is where they're going towards, but it hasn't as yet been finalized. And the outstanding issue there is that there still seems to be a question around whether Aspen would be able to finish it in a full way, and by that I mean actually make the drug substance. Now, that is just one example of how pharmaceutical companies have tried to exert control in this pandemic. If Johnson & Johnson was really interested in equity and scaling up access, they would have given multiple manufacturing licenses on a non-exclusive basis. They maybe would have taken the technology to CTAP. They would have cooperated with the WHO in a more meaningful way. But that is not what they've done, which is why we only have Johnson & Johnson with Aspen, who's now meant to supply the whole of Africa with about 220 million vaccines in the next few months. So when you look at why have supplies not come into Africa, the J&J Aspen deal is one of the reasons, because we've been drip-fed by J&J. And if you only give one license to one company on a partial basis, it's almost impossible for Aspen to meet those targets, anytime soon. Sorry, there was another question you asked around. It was J&J.
Cuba and reverse
the
manufacturing.
reverse engineering. Yeah. So I think what we need to understand is that the mRNA hubs are looking at the mRNA vaccine platforms. And so there we're talking about the conduct of Moderna and Pfizer and BioNTech, because those are the mRNA-based vaccines. And again, like the Johnson & Johnson situation, Pfizer and BioNTech are refusing to cooperate with the mRNA hub and refusing to come in and share the technology in the mRNA hub. So do we have the ability to reverse engineer? Our scientists are saying yes. So the scientists who work from Afrigen, who are one of the partners of the mRNA hub, which has been set up by the WHO, the South African government, and a few other governments are contributing funds towards that, are saying that they will be able to do it, but it will take longer. It will take longer, they predict, because you don't have the cooperation of a company like Moderna. And I think years where the really pernicious conduct of these private companies come to the fore. Moderna says at the beginning of this pandemic, this is why we say it should always be enforceable, we are not going to enforce patents. So everybody, congratulates Moderna for being so forward-thinking in saying that it won't enforce patents during this pandemic. It will decide when the pandemic is over. That's the first problem. But while it states that, and while it's in a dispute with the US government around whose IP that really is, because the US government says it was their scientists, public scientists from public institutions and the NIH who co-invented that vaccine. So what Moderna does is it starts registering patents in South Africa, even though it claims it won't enforce it. And it's done so carefully and strategically that it's not revealing a lot. So it makes it very difficult for the mRNA hub, which ironically is actually based here in Cape Town down the road from me, to be able to do the reverse engineering. Now, would we have been in a different situation if in February of this year, Pfizer and Moderna said, we'll give you the technology, let's share it for the benefit of the world? Of course, we would have been in a different situation. And the waiver would have helped with that. The explicit, technology transfer and cooperation and not the hoarding of knowledge would obviously have helped. So we believe the hub can do it and that there are other manufacturing partners as well, which is why, for example, companies like Merck and Pfizer are now relying on manufacturers, for example, in India, so it's AstraZeneca. There is capacity in the global south and there is manufacturing ability. It's about whether these companies are actually willing to let go of control and of their IP. Sorry, I want a very technical answer.
Yeah, I mean, so let's dig deeper into this intellectual property thing. So Bill Gates penned an op-ed at CNN in October, and he said, look, the intellectual property isn't like a recipe where you have one company A that you can give the recipe to company B. He said manufacturing vaccines often involves living organisms, anything from bacteria to chicken eggs, and these things don't necessarily act exactly the same way every time. And even an experienced vaccine maker might not be able to simply take another's recipe and replicate it reliably. And he goes on to say it was a second source deal with AstraZeneca, not an IP waiver, that allowed Serum Institute in India to produce 100 million COVID-19 doses at very low cost and in record time, and that broadly waiving IP protections would not meaningfully increase the supply of vaccines. Supply has been limited not because of IP rules, but because there aren't enough factories capable of handling the more complicated process of making vaccines. So obviously IP, what comes to mind is a recipe for the actual vaccine, but there are other things that patents cover. And as you mentioned, trade secrets and copyrights. So when we're looking at, and then also at the World Trade Organization, the WTO, which we've been talking about, and looking at the waiver, the Biden has come out in favor of a waiver, but the EU has recently said that they want a narrow waiver. That's about a week or so ago. So can you address what Bill Gates is saying there about the limit, the non-value in his eyes of intellectual property here, the factories, and what it encompasses altogether, the intellectual property, and why the EU would be saying, let's have a narrow waiver?
Okay, so let's just start with the EU first. The EU is flip-flopping on its position. They've been the key blockers of the TRIPS waiver. In the middle of the pandemic, they said, well, forget what 100 countries are saying on the TRIPS waiver. Why don't you go the third way, which is actually a ruse, basically, to delay the passing of the TRIPS waiver. And so the EU came up with this proposal, which is called the EU third way, around using compulsory licensing. Now, we can go into a whole critique of that, but the EU is basically delaying a finalization of the TRIPS waiver. There are a few countries that are instrumental in blocking the TRIPS waiver and not listening to the global south. And the EU has exercised, an disproportionate amount of power in this pandemic. They benefited excessively from these IP protections and the over-ordering. And in fact, they've already ordered all their booster shots. So the EU is not our ally. They are on the wrong side of history. And frankly, this new proposal of theirs of an even narrower waiver is just really, really incredulous, given the amount of deaths that we had and the amount of suffering and the dire situation of the lack of supplies. Now, let's go to that very unpopular, infamous, let's go to the unpopular, infamous op-ed by Bill Gates.
And just real quick, before you do that, what makes the EU waiver narrower? I mean, what comes to mind to me is when you have a patent, right? Usually you disclose your finding and then you have an exclusive right to it. So when I'm thinking of a vaccine patent, if Moderna or whoever has already made this vaccine, they've disclosed the secret sauce to the public. It's just that you can't make use of it. When I'm thinking of a waiver at the WTO, I'm thinking that you're waiving all those rights. What is narrow about what is the EU saying? We don't want full waiver of rights, that only partial, but what is the partial part that they're advocating for?
So like I said, the EU keeps changing its position. The way we understand it is that it doesn't want a waiver on all the medical technologies, which is similar to what Biden said, that he would only support a waiver in relation to vaccines, but not in relation to all the other COVID-19 technologies, which would include, for example, ventilators, PPE, diagnostics, and treatment, right? And treatment is going to become the issue for 2022. So this year has been vaccine apartheid, and I predict that 2022 will be treatment apartheid. So while you will be able to benefit from Merck and Pfizer's antivirals, many people in the global south will be excluded from those licensing arrangements or won't be able to access them timely or in an affordable way. So, and prior to this narrow waiver that the EU was talking about, they were saying you don't need a waiver, you just should invoke compulsory licensing measures in each domestic situation. And we've seen with Canada, for example, and the situation of BioLease in Bolivia, that even a country in the global north is reluctant to issue a compulsory license. It's very difficult, it's rarely used, and usually the company on, whose license or the company the company who's going to be the recipient of the compulsory measures basically lawyers up and will drag you through court for many, many years, right? Even a country like South Africa with a really great constitution has never issued a compulsory license on a pharmaceutical product in 100 years. It's a really difficult thing to do. So if we come back to the infamous, controversial, ill-informed op-ed by Bill Gates. So let's just take a few steps back. The foundation itself did an about turn. It first was not supporting the relaxation of IP in this pandemic, but then because of a lot of outrage and a lot of pressure, and the fact that the Vatican, Dr. Fauci, Nobel laureates, former heads of state, the IP academic community, scientists, activists, there's a broad movement of people. It's not just a group of ex-estimates and activists and the South African and Indian government, 100 developing countries as well, supporting the TRIPS waiver. The foundation issued a statement saying that we need to actually deal with the issue of IP and there probably needs to be some relaxation. So they did an about turn. Despite that, Gates himself has continued to basically spew these arguments out around why he thinks, and he called it, I think he called it a stupid or ridiculous or something. He gave it some description. He said it's a stupid idea and that the world doesn't work that way and you don't have manufacturing partners and you need this and you need that. So every excuse that the pharmaceutical industry normally uses, these are, in our view, the speaking points of the industry. These are all the excuses and in some cases very racist assumptions around what is possible and what is capable, what is possible and what we are capable of. And I think it goes back to what Yamo had asked earlier about what is our manufacturing ability and capacity. So we think he's wrong in many respects. And we think that basically he has his own vested interest in why he needs to preserve and protect intellectual property claims. Because there is an existential crisis that the industry is going through, that if you allow a waiver in this pandemic on these medical technologies, what happens with the next pandemic? What happens with life-saving access to HIV/AIDS medication or TB or cancer medication? And remember, this industry is so profitable, right? Like we've seen in the last 2 years, nobody wants to let go of the IP or the control where there's greater sharing of technology, because it means it would harm their bottom line. So, many of us have critiqued Bill Gates. We think he's wrong, and we think that he will always be remembered as being on the wrong side of history. He has totally misjudged the situation. And frankly, I would rather listen to Joseph Stiglitz, a Nobel laureate, an economist, around why the waiver could actually be more useful and would actually be more beneficial than listening to somebody like Bill Gates. And I think it goes also to the heart of power, right? If you have somebody like Bill Gates saying these things using CNN platforms, it's really dangerous, because here you have somebody who's unelected. He's not an elected leader of any nation. We can't hold him accountable. The only way you can respond to him is write an op-ed. But he has a seat in many different places. He has a lot of influence. The way he's using his power is not positive, and it's not constructive. And his views about the need for a TRIPS waiver, I think, are really ill-informed. And it's actually quite disrespectful to the 110 nations that have said, we have looked at the evidence, we've looked at this, this is why the TRIPS waiver will help, and we need that. And, frankly, everybody kept on saying, from that particular quarter, that the TRIPS waiver won't make any material difference, it won't have an impact because you don't have companies in Africa, you don't have this, you don't have manufacturing, you don't have good practices, not so easy to make a vaccine. Yet there's been so much opposition to the TRIPS waiver. Right? So it's a bit ironic that you would put so much time and energy and resources in blocking the waiver. If you felt it would have no material difference, then you should have just approved it in January, because then in your own assessment, according to people like Bill Gates, it wouldn't change a single thing because nobody can do anything. But implicit in their opposition, right, and why the EU has held out for so long, is that they know it will make a difference. They know that there are manufacturing partners out there. They know that it will dramatically shift the landscape of access, not just in this pandemic, but going forward. So let me stop there. Otherwise, we can talk about this like the whole day.
Yeah, I think we all know that it's quite possible that we could end this pandemic. At the very least, we could manufacture our own vaccines. And I'm excited about the work of the People's Vaccine, the fact that so many people have come together, both, arguing for the TRIPS waiver, but also building capacity for that manufacturing. I've seen that there's work by the AU to also create regional standards so that when we begin manufacturing, countries don't have to do that work from scratch. So there's a lot of preparatory work, in the motion so that we can make our own vaccines. I do want to move the conversation a bit more toward what's happening with travel bans, Omicron variants. And, there's so many different talking points here, very different parts of analysis here. I'm wondering from your side, what do you think about this? Obviously, you've been speaking a lot about power and how all decisions in international relations are just consequences of power. Is that as simple as what we're seeing with this travel ban? And more importantly, does this new variant move us closer to the end of the pandemic or not? I think many people have lots of different takes on things like that.
Yeah. So obviously, I've spoken about this and I've said this repeatedly, that the travel bans are racist. They a knee-jerk reaction in the middle of a pandemic to a variant that was reported on by South Africa, but certainly was not first discovered here. It now turns out that it was actually circulating in the Netherlands and in parts of Europe even before South Africa alerted the world to the emergence of the new variant. And the reason why we say that it's a racist, uneven application of a travel ban is that the countries where the variant has been discovered are not necessarily included on the travel ban list, not even for the US, not even for the EU. So when you look at the countries that have been isolated, that are being discriminated against, they all happen to be in Southern Africa. So, there's a certain irony that there are there's community transmission already. Is a travel ban, the most effective way of dealing with this? Our experts are saying not, because it's basically you at the level of community transmission. It's very, very difficult to contain it. What you can do is perhaps make sure that everybody's vaccinated in the world to ensure that people are less at risk of infection, or if they are infected, that they basically don't have to be hospitalized. And that is why at the heart of this, and the head of the UNAIDS has just written a piece in the last few days talking about vaccine inequity as a driver of variants. But we warned about this in 2020. We said, the longer you take to vaccinate everyone everywhere, it's a key rallying call of the People's Vaccine Alliance. There's a reason for that slogan, everyone everywhere. Because if you don't do it at the same time, not 11 months apart or 2.5 years apart, if you don't do it at the same time, you create the perfect breeding ground for new variants and for variants to circulate. So the travel bans are, we believe, an irrational response to what has happened in the last few weeks. And it's really racist because it really targets us. And instead of, working with us and providing the global solidarity to work with the scientists that actually did this fantastic work to alert the world and to show it, because scientists in Botswana and South Africa have been formidable. What we got was in turn, was a ban that was slapped on us. While we can show that some of us are fully vaccinated. So there's no reason to preclude somebody from traveling if they've already received 2 shots of a Pfizer vaccine, if they can give you a negative PCR result. What does Canada do in the last 48 hours? It says that PCR test results from South Africa, from other countries in Southern Africa, won't be accepted. So, this is ridiculous. So our PCR test results won't be accepted. You must go to some third country somewhere, do a PCR test there, show them the result. Your vaccination status is not considered sufficient enough for them to allow you into parts of the global north. So a person from Canada with a double shot of Pfizer is somehow considered to be more immune and can travel than a person from Cape Town with a double shot of the Pfizer vaccine. And the only difference between us is our geography. I come from Africa and that person comes from North America. It's so enraging. It's so ridiculous. But the good thing about the travel ban, the only good thing about the travel ban, is it's united our country to basically highlight the issue of vaccine inequity at the global level. Our scientists, our doctors, our president, our community healthcare workers, our religious leaders, our activists, everybody is speaking with one voice to say, how dare you? How can you respond this way in the middle of a pandemic? And so it goes back to what you asked, the first question about how we were promised all the solidarity in the beginning. And what did we say? These are just words. They are not enforceable. And it's actually getting worse. So that's why I think that next year you'll be having a show on treatment apartheid.
Yeah. So if we're looking at some of the proposals and some of the popular general public responses to this, you have calls for mandatory vaccination, which has stirred up some controversy. We'd like to know what you think about that. And then we also have, some issues. Maybe Siamo will comment on it about, education and conspiracy theories. But what do you think about the notion of mandatory jabs? I think something like just under half the South African population said they're not interested in getting a vaccine.
So it depends on which study you cite, because the studies by Kate Alexander at UJ and others actually show that there's a greater willingness to take the vaccine if the right factors are available. Transport is a huge issue. The distance to the closest site, the issue of side effects, whether somebody can get 1 jab or 2 jabs, whether their peers are getting the vaccine, whether there's a vaccine mandate as well. So I think that the percentages and the different studies circulating can sometimes be misleading. It's certainly not true that half of the people don't want to take the vaccine. I think we've had many issues that have, where we've lost the momentum in our vaccine program, but that is not the sense of the community, or the majority of communities actually in South Africa. And the Right to Care, for example, is doing fantastic work in rural facilities in South Africa, where those communities are saying, thank you for bringing the vaccine to us. It's also about, are we taking vaccines to the people? Are we allowing fertile ground for the anti-vax movement, which is really aligned to organizations in the US that has been peddling a lot of misinformation and disinformation. And we saw this with the HIV/AIDS crisis. So we're having to do treatment literacy, we're having to fight for supply visibility, we're having to fight for access, we're having to fight for fair pricing. So there's a lot of things happening in South Africa around uptake levels. And that is where vaccine mandates, I think, do have a role. And unfortunately, our government was basically sleeping on this issue. And it's only now that they've decided to set up a task team to look at whether government should actually adopt a policy of imposing vaccine mandates. And the thing about vaccine mandates is we already have vaccine mandates. You can't go to country XYZ without the yellow fever vaccine certificate. You can't go to school without your measles vaccine certificate. So there are already vaccine mandates in the system for multiple conditions. This has become controversial and it's become a lightning rod because there's been a sense of individual liberties around, basically fueled by the anti-vax movement. People believe that they don't want to be told to wear a mask. They don't want to be told that they have to take the vaccine. We have 2 universities in South Africa, leading universities, who already adopted a resolution on vaccine mandates. You won't be able to return to class or be a teacher in a class unless you are actually vaccinated. We now have one of the largest trade unions in South Africa doing a U-turn and now supporting vaccine mandates after the emergence of the new variant. And they've realized that if we don't actually scale up vaccination and get more people vaccinated, we're going to be isolated even further. Our economy is going to suffer and we're going to be decimated as a country in terms of hospitalization as well as in terms of morbidity and mortality. So there is a debate around vaccine mandates. My own view is that it's about time. If you want to go to a public space, if you want to go to a public school, public university, public places of worship, you need to be vaccinated. And that does mean, however, like we did with the situation of ARVs, when there was a lot of disinformation and hesitancy, is that you actually have to invest in sharing information with communities and communicating to people in a way in which they are the most comfortable. But we've had so much of secrecy and so much of and minimal information sharing in 1 year, where we had political violence as well and a set of local government elections, where drug companies have also been rolling out vaccines based on press statements. And not sharing a lot of the data. And then we've also had the stopping and the starting of our vaccine program. We were going to use AstraZeneca, then we decided to pause that for certain reasons, then we started using J&J, then we paused that because of the issue of blood clots in the US, and then that was restarted. So there's a lot of confusion in communities. Which vaccine should I take? Should I take J&J? Should I take, Pfizer? Because that way I'll get 2 doses. Remember, we don't have a booster approval or authority as yet. So yeah, it's a complex set of factors, but my own view, and based on the experts we've spoken to, is that the vaccine mandates could turn the tide and could actually have an impact. But we're only dealing with this now because we are months behind, a vaccine program that you started, for example, in January. So where countries have already decided on vaccine mandates, they've done that ahead of us because they were obviously ahead in terms of their own vaccine program. I mean, I was supposed to travel to Geneva for the ministerial conference, for the WTO meeting. And one of the requirements was you had to be double vaccinated, you had to prove your vaccine certificate, you had to take a PCR test, but you wouldn't be allowed to enter a cafe, a shop, the WTO building, any public space in Geneva, right, without proof that you were vaccinated. And I really think that's where the world is heading now.
I've got a question, Fatima, about bottom-up vaccination drives and why we aren't seeing a lot of those community-driven initiatives. I mean, Limpopo had a lot of that, and you've seen that they've caught a higher vaccination rate. As a result, Free State coming in second. So I'm in the Free State, and we have a lot of these community initiatives. Like, I work with an NGO. We work with homeless and impoverished people. We had 2 months of workshops just to speak with homeless people in the area about vaccinations, to make sure that even when they're receiving a vaccine, it's like it's their agency, it's their own individual choice. And I mean, I'm very vocal as well on Twitter about a lot of the top-down approaches. Like, I'm the expert. Listen to me. Don't listen to this random person on Twitter who's not an expert. I'm like, yeah, that's totally going to convince someone to get vaccinated when you talk down on them. And I'm also 23 years old. So I'm a young person. I speak with a lot of young people. I'd say most of the young people I know are not vaccinated and probably won't even get vaccinated even after a vaccine mandate. They would just stay away from those public places, or, I don't know, bootleg, or try their best to avert a top down. And I do see the, white people in Cape Town sort of copying the US, but there's also a really strong, supposedly conscious, we're against pharmaceutical corporations movement as well. And it is empowered by what you said a lot in this call about some of the stuff these pharmaceutical companies have done in the past and the way that they're behaving right now. So I wonder, I guess the snapshot question here is, we saw the treatment action campaign, during that time of AIDS denialism, but are we seeing a TAC level vaccination drive right now, or are we seeing more of a top down, where experts listen to us, we know what's good for you, you guys are wrong on this issue, sort of, you have to listen to us? Where's the TAC solidarity, working together in communities, building support for something like a vaccine, just like we built support for ARVs? Working with, I sort of wonder if the activist approach a lot of us have taken is too top down on this, and that obviously feeds into the vaccine mandate kind of conversation. I wonder what your thoughts are on that. Is there a bottom-up movement? How do we build one?
So I think there's a combination, and I think there's a lot of faith leaders, community organizations, sex worker rights organizations, HIV/AIDS organizations, even organizations doing work with refugees and migrants and homeless people that are doing the bottom-up work. I think it's just that the media doesn't really report about them or talk about them. For example, the work that Right to Care is doing, or the Aurum Institute. So I think that it's been compressed within the space of a year. We're trying to get to 80% vaccination coverage within 5 or 6 months. That's an impossible task for almost all, even advanced healthcare systems. We do have a dual healthcare system. I mean, the vaccine program was rolled out as a single vaccine program, which has also created, different elements of access difficulties. And I think you're right. I mean, I think the Limpopo example, was something that surprised everybody. But Limpopo themselves said that there's so much distrust in the community and there's so much hesitancy. And what we need is not for politicians to speak to people. So your point about top down, you've got to bring in community leaders, and you've got to bring in people that communities trust. That's made obviously more difficult if you have the Chief Justice of the country, saying that the vaccine is the devil. If you have groups that are so aligned to these US anti-vax groups, I mean, the Panda, there's various people who are quite active on Twitter, on the internet, on TikTok, who are using social media to create the hesitancy and to build up the anti-vax movement. What we've been told is that people are using WhatsApp, the voice notes, which basically say, don't go take the vaccine. This is what's going to happen to you. These are the side effects. So it's quite a different time to when we did the work on HIV/AIDS. I worked for the AIDS Project and did a lot of the legal cases for the THC, because we're dealing with a very sophisticated social media space, and how you intervene in that space and how you get young people to actually listen to different messages without coming off as paternalistic, I think is different to the work we did then. And I think you're right. I mean, with HIV/AIDS, we had years and years to basically build up treatment literacy while we were fighting for access to vaccines. So it's a very different situation that we're in with COVID, because the timelines are so compressed. It doesn't also help that the work that the Department of Health was supposed to do around better communication. I totally agree with you about how do we communicate with people of different age groups, different geographies, different class as well, different, some are university users, some are not, for example. That you had a department that has had 3 different ministers of health. You had the senior leadership as well as the former minister implicated in corruption allegations around the very contract that was supposed to communicate around COVID-19. And so, there's also the internal deficiencies within, I think, our health system and the Department of Health that has meant that grassroots groups and faith organizations and others, we've actually had to step in to do the work of government around vaccine literacy. And frankly, I think that they also underestimated that there would be this kind of pushback by the anti-vax movement. And they've been too soft, I think, on some of these groups in terms of spreading disinformation, even though we've passed laws around COVID disinformation and misinformation. They actually haven't really used all of the power available to them to basically shut it down.
All right. Well, maybe kind of moving towards a close here. There's a lot of things that could be done differently and should have been done differently. We've discussed a lot of that today. We talked about the intellectual property waiver at the World Trade Organization. There's obviously hoarding of vaccines by the rich countries. They're opting for their booster shots right now when, so many people in so many other low-income countries don't have access to vaccines. Obviously, there's education and awareness raising, not just about vaccine apartheid, but, contesting with skepticism and conspiracy theories. If you were to say, what is the real, how much is this about intellectual property and resource hoarding and profiteering, and versus, building up the capacity to manufacture? Really, what do you think needs to be done, and what are the top priorities in order to bring this pandemic to a just close?
Yeah, to end the pandemic.
Yeah.
Yeah, I mean, unfortunately, I don't know if the end is near. In fact, I think it's just going to continue for a while, because I think that the entire response to this pandemic has been mismanaged from day one. So I don't know if there's anything you can do to actually end the pandemic. What you could do to mitigate the consequences of it is to continue to invest in strengthening health systems so that people can still get their treatment and services while we're dealing with this pandemic, which is, really ruptured access to other treatment, cancer or ARVs, for example. But is to ensure that more people can get their first shot, in an expeditious way, and then a second shot, particularly healthcare workers and people who are over 70 and people with comorbidities. And so I think the prioritization of which groups, including, and I think this is part of the problem about excluding certain communities like refugees and migrants. Most countries have just not prioritized that, or people who are homeless without documentation, for example, right? The TRIPS waiver is an essential part of a package of interventions. It's obviously not, the only solution, but you need to resolve that or expeditiously deal with that, because that is, I think, a critical part of being able to say, we've got to suspend IP in this pandemic. And we can't all afford to be pursuing compulsory licenses in each of our country on every single supplier for every single technology. So the IP reckoning and the IP issue has to be resolved, and it has to be resolved fast. I mean, one of our demands is that the WTO should just pass the waiver in a virtual meeting. You don't need an in-person ministerial conference. You don't need to wait. You can actually do this if you really had the political will. Linked to the TRIPS waiver is that while we are waiting for that process to be finalized, you need more manufacturing, and you can only have more manufacturing if you issue multiple non-exclusive licenses to as many partners as possible, including the mRNA hubs, and for companies to basically stop playing God. So all of these licensing deals and arrangements is still rooted in this notion of volunteerism and the company exercising full control about the terms and conditions. And that's not sustainable. That's not going to work, particularly, as we're now starting to talk about treatment. So segmenting markets, dividing geographies, having the haves and the have-nots, which is basically apartheid, right? First-class citizens and second-class citizens is actually not going to take us out of this pandemic. And what we saw with this variant is that you're actually going to prolong it. And just finally, I mean, what we need to end is just this like racism and the exclusion and the discrimination and isolation. You can't mitigate the consequences of this pandemic if you're going to isolate half of the world and think that is going to be the thing that keeps you safe. So the experts are saying vaccinate everybody, make sure there's mask mandates, not just vaccine mandates. You've got to invest more in PPE and diagnostic capabilities. I think it's a package of things. But at the heart of it, obviously, because I'm a medicine access activist, is that you've got to topple the IP regime that is currently being the biggest blocker of trying to even scale up supplies. And with the booster shots that's being administered, that tells you what's going to happen, right? It's not a one-shot vaccine program. We're going to be doing this for years. If we can't even get our first shot, I don't even know when we're going to be able to get our second and third shot. So yeah, we have a real crisis of inequality on our hands.
Yeah, I think final thoughts from my side, Mike, especially listening to Fatima talk, it does sound like we have a global alliance in agreement that intellectual property in relation to medicine that's necessary for people to sustain life is unjust. More than it being unjust is simply an act of power rooted in, trying to keep people who are brown and black like us under in this part of the world. And everyone listening to the podcast, I think we know that we need to rise up against this. The Health Justice Initiative, Right to Care, there's organizations around the world that are fighting this. Thank you for speaking about them, Fatima. I'd imagine that you should also get involved in whatever local community you're in. If you have access to a vaccine, engage with people in your area. We're only going to vaccinate everyone here in South Africa, across the continent, when vaccines are made available. If we work together, I do believe a bottom-up approach will be way more effective at spreading the vaccine. And finally, from my side, if we're going to take down the tech empire, we should definitely also take down this intellectual property empire related to medicine. And I'm excited for that.
Great.
Yeah, all right. So I guess that's a wrap. Fatima, thank you so much for coming on the show. It was a pleasure to have you on.
It was a pleasure to be speaking to you and Tiamo this afternoon.